All right, welcome back, everybody. We're taking a live look at Fort Myers there. It is a For Your Health Tuesday, and this morning Dr. Sal is in the house to talk about brain attacks.
Brain attacks.
They're similar to heart attacks.
Right.
And that is a real condition or a term, right?
Right,
Tell
exactly.
us about this.
Well, it really is a true medical emergency, and it is something that people should call 911 if they have any of these symptoms. So basically, this is a significant acute decrease in the blood flow to the brain, either because of a blood clot or because of bleeding. So people will sometimes have symptoms where all of a sudden they're foggy in the head, their mental status changes, they may have some slurred speech, some difficulty moving an arm or a leg. So at that point, you really need to understand that this is an acute medical emergency and you need to call 911 and go to the emergency room.
Wow. And who would this be affecting? At any age, or I suppose people who are stressed out would maybe may mistake that, right, for just being stressed?
People that have had strokes in the past, people that have uncontrolled high blood pressure, people that sometimes are on blood thinners. So any significant change like that, those are all risk factors, and any significant change with the symptoms that I mentioned require somebody picking up the phone, calling 911. Don't ask someone to get you in the car and take you to the hospital. That could be a fatal mistake.
Really?
Yeah.
Wow. Okay, so let's go over those symptoms one more time, though. That would maybe be different from saying, I think I'm having a headache and I don't feel good, to what really would be making somebody call 911.
Right, and actually that's a good point. So, you know, an acute headache, certainly in adults that have not been having headaches in the past, a change in mental status, slurred speech, an acute problem with your vision, problems moving an arm or a leg. So all of those things are really severe neurologic signs that would tip you off that this is really serious. I need to pick up the phone, call 911, go to the emergency room. So
for all those people who are stubborn and don't like to go, that's when you know the difference and you really need to call. Let's talk about how we can prevent this too from happening. You know, we talk about preventing heart attacks, getting heart healthy. Let's talk about being brain healthy.
Right. Well, cardiovascular disease, and this is could be another form of cardiovascular disease, just blood vessel disease. So keeping your cholesterol well controlled, keeping your blood pressure controlled. Exercise is a great preventive treatment to keep the brain healthy, like it keeps the heart healthy. Eating a low-fat diet, lots of plant foods, you know, vegetables and fruits and things, and staying away from meats and things that will raise your cholesterol. So all the things that we always talk about in relation to prevention: healthy nutrition, regular exercise.
And you know, we talk about that because we think it's going to help our bodies, we think it's going to help. We talk about the heart a lot now too, but we forget about the brain sometimes too, you know. So all right, Dr. Sal, great tips. Thank you so much. We appreciate it.
Nice to see you.
All right, good to see you too. Got to keep a clear head at times too.